Could you hear that airplane go by?
Didn't hear it.
Okay, good.
Okay, looks like we have folks coming in. We'll go ahead and get started in just a minute here for those who are joining. Okay, I think we're slowing down on people joining, so I will go ahead and get started. Hello, everyone. My name is Hannah Wickern. I am a project manager with the Intertribal Council of Michigan. I'd like to welcome you all to this motivational interviewing for vaccine hesitancy training. This training is made possible by the Tribal Vaccine Equity Project, which is administered by the Intertribal Council of Michigan to help provide tribes, tribal health centers, and tribal health employees with technical assistance, training, and resources to support local vaccination efforts and also address vaccine hesitancy. Today, we will be welcoming Alaska Primary Care Association's Behavioral Health Integration Coordinator, Sevilla Love. Sevilla was born and educated in Alaska. She earned her Master of Social Work from the Washington University in St. Louis and also had an early start in the medical setting at Mayo Clinic. Since then, she's continued to lead up the front lines of cutting edge quality improvement for the integration of behavioral health, telehealth delivery, and team-based care in Alaska. Sevilla teaches screening, brief intervention, and referral to treatment process, or SBIRT, as well as motivational interviewing, ACEs, and brief interventions for primary care and integrated team-based care with a focus on quality improvement in rural healthcare. Accompanying Sevilla today is Stephen Fowler, also from the Alaska Primary Care Association, to assist in the role-playing portions of this training. So today the training will talk about the spirit of motivational interviewing and how it can help vaccine hesitant patients get off the fence of indifference without increasing your stress levels as a healthcare provider. Please feel free to introduce yourself in the chat box with your name and organization. You can also type any questions you might have throughout the training in the Q&A box, which is also found at the bottom of your screen. We will also have polls throughout the training, so please be sure to participate in those. We'll make sure to record this and have it available on our website, which is keepitsacred.org/ITCMI.org/vaccine equity. So we will have all of that info on there as well as the slides. So with that, I would like to pass it over to Sevilla to go ahead and get started. Thank you.
Thank you, Hannah. Well, I'm excited to be here today, and I want to welcome everyone. I'm here. We are in Alaska right now, as we had previously mentioned, so we're very happy to be meeting you wherever you're at. And I want to start this training today with a story. So here's a grandmother and a grandchild, and the granddaughter says to Grandma, "Grandma, what is that mark on your arm?" And Grandma says, "Well, that's my smallpox vaccine scar." Well, granddaughter says, "Well, why don't I have one?" And grandmother says, "Well, because it worked." This makes a great poster for your clinic, but let me say a little bit more about this. So I really want to open up with this backstory. Okay, I need to move this here. So back in the 1700s, there were these young milk maidens, and they tended to the cows who would often get an infectious disease called cowpox. Now, this was a very mild case and not lethal like the smallpox virus that people could get. But what they found is that these maidens were not getting smallpox at all. So one curious physician saw a possible correlation and started taking the pus from the cowpox and began spreading it on to other people. Those people would get the cowpox, but what they didn't get was the deadly smallpox virus. So we might actually consider this one of the world's first vaccinations. However, it wasn't until the mid-1900s that there was a worldwide smallpox vaccination campaign, and by the mid-1970s, smallpox was considered eradicated, and we're able to discontinue vaccinations. So stories really are how humans learn best. And it's this kind of narrative that may give our patients reassurance about all the vaccinations, because it demonstrates that vaccines are not new and that they do work. Okay. All right, so just a reminder that this does make a great poster. If I don't know if they're going to make these slides available, but it is wonderful, and just quick and to the point. So let's talk about what we're going to learn today. So we're going to have 4 effective engagement skills that we're going to share. Not necessarily MI skills. What's that when I say MI? I'm not talking about heart attack, free medical providers. I'm talking about motivational interviewing. So it's just a shorter way to say that when I say MI. So we're going to have 4 engagement skills that I'm going to share with you. And then 4 best MI skills. It's going to help you to address that patient ambivalence. It's going to help to increase your confidence, to improve vaccination rates and other positive health outcomes, because of course MI is used for everything, and then be able to decrease your stress level, because we know those have been high. People are sick of hearing about this, but yet we still have to deal with it. And so how can we make this easier on ourselves and on our patients? So motivational interviewing is culturally respectful. This is a really important thing to know, and why it's good for us to learn when we're working in multicultural situations all across the country, all across the world. Studies show that people who demonstrate what we call the spirit of MI in their work with clients versus those who held fast to some kind of set of verbal tools or techniques, that they were actually more successful in helping other people achieve positive outcomes. And that's from the research of Miller and Rolnick, who are one of the founders of motivational interviewing. It's culturally respectful because it's collaborative, it's evocative, and it respects the person's autonomy, their own autonomy, versus us coming in and telling them what to do and how to do it. And it's compassionate, and all humans are responsive to compassion. And so the Dalai Lama, when we talk about compassion, he probably knows it quite well. If you want others to be happy, he says, practice compassion. And if you want to be happy, practice compassion. So does this really work? That's the question. We have to have reasonable expectations for these types of trainings, because we're dealing with human beings and we know that we're a variant bunch. So people who are hardliners about this vaccine are not the ones that you're likely to reach, but it doesn't mean that you can't try to soften them up a bit to help them possibly change their minds down the road, or to be more supportive of others getting the vaccine, that they might not be so against their friends doing it, for example, to be more cautious, to protect others, and so on. So this could be of great value in maintaining your provider-patient relationship, even if they are hardliners, because we want them to be able to come back and still try to be healthy human beings. So that's what might be some kind of a reasonable expectation around that population. But we will address how to work with these hardliners. There are people who are on the fence about getting vaccinated, and this is the population we're actually targeting today in this training. We're going to provide some communication tips to help you manage them respectfully in this presentation, and not argue with them at all. Okay, which is what we call rolling with resistance, and this is an MI skill. So in regards to MI, you're not going to leave here an MI practitioner today, but you may get a more in-depth exposure to what MI looks like in action and how it can be useful for you as a healthcare provider when you're talking to vaccine-hesitant people. Motivational interviewing is evidence-based, and when it's done well, it works well in helping people make decisions about all types of healthcare issues. So doing an in-person training where you can actually practice these skills in MI would be your best bet for making a powerful impact on your skill level, which we can't provide in a short online training like this. But if you're familiar with MI already, then this would be a good review for you. The point of this training is to help you decide if you would like to learn more. You can still make improvements from thinking on things differently and trying some new approaches when it occurs to you to try them out. So what this training is not, this is important, this is not an education in the science of COVID-19 or the science around the vaccines. While I have worked with medical teams for most of my career, I am not a medical provider, but what I am is a skilled clinician with over 20 years of experience and working with change-resistant people, helping people to see things in new ways and to find their motivation to do stuff differently. I mean, isn't that what we're all hoping to do in healthcare? Help people change so they can be healthier and hopefully save lives. Now, I teach motivational interviewing to healthcare professionals. The information provided in the role play that you're going to hear later and the resources provided for future consideration are just examples used to showcase MI skills and starting points for your ongoing learning. Providing medical and scientific education to your patients is in your hands as medical and healthcare professionals. This training simply demonstrates what a conversation could look like with a vaccine hesitant patient using the spirit of motivational interviewing. And lastly, now you might not agree with all of these approaches, and that's okay. You might wonder how you could possibly have a conversation like this in a short period of time. But the truth is that research shows that a skilled MI conversation is actually more efficient, not to mention successful, than a traditional persuade and convince conversation. So keep in mind, this is only an introduction. And if you walk away with 1 or 2 new tools to try out and you decide that the rest aren't right for you, then that's fine. One good tip can make a domino effect in moving your own communication skills in a more effective direction. And that is time well spent. So what is vaccine confidence? We talk about hesitancy, but what's confidence? The confidence is the trust that professionals and patients have for the recommended vaccines, the providers who are administering them, and all of the process and policies that lead to that vaccine development, the licensure, authorization, manufacturing, and the recommendations for use. So this is a screenshot from the cdc.gov, and this is to show vaccine hesitancy in the contiguous United States. So you can just take a look at that and see that the dark colors show about approximately 3 to 6% hesitancy, and so there's different levels of this hesitancy and how they define that. So let's talk about what that is. So our target group is people that are on the fence, okay? Because we want to try to help them make a decision about getting the vaccine. We're going to addressing the person who's on the fence about it. So the strongly hesitant people are defined as people who said they definitely would not get a COVID-19 vaccine. The hesitant is people who were probably not or definitely not going to do it. And then the hesitant or unsure was those that included the probably not, unsure, and definitely not. Okay, so there's a lot of people that are unsure about it, and hopefully we're going to be able to reach them. Now, these people are ambivalent, and ambivalence is when you don't quite know what you want. You feel more than one way about something. So, for example, you're like, on the one hand, I feel this, and then on the other hand, I'm really afraid of that. And so you're just in the middle. And being on the fence hurts your butt, as we like to say. So hopefully we can help patients to make those decisions. And what are we going to do about the hardliners? Because everybody wants to know, is there anything way we're going to change somebody's mind? Probably not, but we can set ourselves up for some success with the art of persuasion. Now, if you want to change someone's mind, you need to think about persuasion. Essentially, you're removing the reflexive mental blocks that might make them reject your viewpoint or the evidence or the education that you're presenting. So Professor Karen Douglas, a psychologist who studies conspiracy theories at the University of Kent, says the following: the first step is to establish empathy. Often these people are very worried about something, and this issue is important to them. It would not be constructive to go into the conversation in a hostile manner, because this delegitimizes their concerns and might alienate them even more. End quote. So this brief introduction is going to demonstrate what this looks like in a skilled MI conversation to hopefully tempt you into learning more about this effective and evidence-based technique. So what works and what doesn't work? Big question. Okay. So first, I'm going to cover the 4 communication skills that complement the spirit of MI. And it's going to help you to connect in more meaningful and effective ways with your vaccine hesitant patients. And then we're going to look at what doesn't work so we can compare and contrast why the following MI skills we will cover do work well. Then we're going to put MI skills in action so you can not just hear about how they work, but see it firsthand and understand why and how it is working. But before we get into the specific MI skills, let's go over some of these generally good communication skills to employ in any interaction with the patient. So let's dig in. Okay, so using names works. A person's most powerful connection to their self-identity is often their own name. So when someone uses and remembers our name, it can really make us feel a little bit more important to them and more respected. When it might be the most important word in the world to someone, it can make a lasting impression on us. It means something. And when we feel respected, we're actually more likely to respect what is being said to us. Okay, so we're improving our connection and increasing trust. Good humor works. Now, not everybody's a big jokester, and that's fine. You may be a very serious person, but you can lighten your affect a little bit. You can come in and introduce yourself with a little more relaxed air about you. And the smiles and gentle humor that we have can go a long way to helping people to feel comfortable with us. And it actually makes you more real and less of an authority figure to argue against. So you're meeting them at a common basis level. So there is not this hierarchy, although you do have a medical authority, and we're going to talk about that because medical authority does work as well. We're going to show you the respectful use of your medical authority and why that can work, how it can help. Because most patients will go along with the provider recommendations when they're ambivalent. Okay, they're hardliners, they may not, but if they're ambivalent, you have the opportunity to help to sway them towards scientific evidence. And you'll do that by making clear, strong recommendations in a respectful way. What else works? Vulnerability. Vulnerability works. Vulnerability helps to level the playing field and foster trust, which is so important to get people to listen to us. So patients come to us at their most vulnerable. They're sick, they're tired, they're scared, they're in pain, and they're often desperate for help from their suffering. When we share our own vulnerable stories, it makes us less of the medical, political, or fear-based story that they may be resistant to and shows our respect for them. You're welcoming them into the circle of trust. You've humanized the interaction. When it comes to vaccine hesitance, fear of making the wrong choice for their health is often at the bottom of their reluctance. And that is where we want to reach them, in that space. So our own personal stories can help put us on a level playing field and create that space for trust and authentic conversations to take place. And so that education has a better chance of being received. So Brene Brown is a doctor of social work. She's a very famous researcher around vulnerability. And this is what she says. Vulnerability is not winning or losing. It's having the courage to show up when you cannot control the outcome. When you shut down vulnerability, you shut down opportunity, end quote. The goal of story sharing is to increase connection with our patients so they feel more confident in you and in the vaccine. People are statistically more influenced through relationship than they are through science alone. People are listening to their friends, their family, their loved ones, and probably, if they're on the fence or hesitant, resistant, they're not listening to the medical providers or science for the most part. And that's okay, they get to do that, but we may be able to help them with that. So the last quote from Brene Brown I want to share is, "Connection is the energy that exists between people when they feel seen, heard, and valued. When they can give and receive without judgment, and when they derive sustenance and strength from the relationship." And this is where your medical authority and your relationship comes into play to help people get off defensive indifference. Okay, so is this manipulation? Using all these different skills, names and humor and authority and your vulnerability. Are we being manipulative when we purposely use all of that? Okay. Is the story sharing that we use to invoke connection and trust manipulation? I would say that we're using positive influence, but not manipulation, which has a malcontent associated with that. No one goes into healthcare with the intention to cause harm. We want to heal and create health in our patients' lives. That's why we're here. So any kind of education, tool, or skill set that we can have to help us reach that aim may be considered a noble use of our healing intentions. This is why having excellent communication and persuasive skills is a good medical practice, because by doing so, you are forced to focus on them, to consider their needs, their desires, fears, and their motivations. Using these skills or tools just as valuable and important as the medical knowledge in your head. So if they're in a constant state of resistance or reluctance to change their health habits, how are you going to help them? Think of these communication skills as the platform you use to deliver the good medical care that you're offering. Okay. So we're going to be doing some role plays today to demonstrate MI skills and what's not MI skills. And so I want to introduce Stephen. I just want to welcome him and thank him for his help and support in this training today. He's going to be doing the role of our medical provider and demonstrating the MI skills from that. He's our clinical informaticist at the Alaska Primary Care Association. So let's talk about what does not work, all right? And that is the writing, something we call the writing reflex. The writing reflex, also known as the persuade and convince style. It's when we need to be right versus being a skillful listener. And that means looking for opportunities to help influence and engage in a respectful manner for the good of the patient while honoring their autonomy. And so Stephen and I are just going to do a brief role play here. Now, when we do role plays, I'm going to be using a sound effect so you know when the role play begins and when it ends. This is the sound of the beginning of a role play. And this is the sound of the end of the role play. Okay, so Steve and I are going to begin this, and
now that I've explained the risk factors, you can see why you need to make this a priority. You're long overdue.
Yeah, but I just don't trust it.
If you cared about your health, you'd listen to the science behind the vaccine and accept that this is the best choice to keep you safe and healthy.
Yeah, well, I've heard way too many stories that scare me much worse than getting some virus that has such a high survival rate.
The potential side effects are nothing compared to what could happen if you got sick with the virus itself.
Well, besides, I hate needles. I never even get the flu vaccine, and I've been fine all these years without it.
Well, you're putting yourself at risk, and it's the safest choice you can make. Think of the people in your life you'd be putting at risk if you don't take this, let alone society at large. This is really important for you to do.
Okay, thank you, Stephen. So you can see that this persuade and convince style is not motivational interviewing. Not at all, but this is the model that most of us work under when we're talking with patients, when we're talking with our friends and family. This is the great thing about MI, is this can also work in your personal lives as well, in having conversations with friends and family, not just around the vaccine, but about anything, because we often find ourselves at odds with other people, and learning how to have a conversation with them so we all come out winning in the end at least maintaining the relationship, is really important for all of us on a personal level as well. So this writing reflex, we're going to learn how to not do this because it's a fallback for most of us, and I'm guilty of it too. So we all do it. So let's talk about the confidence ruler and how that works. Okay, so the confidence ruler, in some research that was done by Martin, Hoke, Christopher, and Tongan, printed in the Journal of Consulting and Clinical Psychology in 2019, described it as this. They said that discovering the confidence workers ruler, helps people to discover their own interest in considering or making a change in their life for like diet, exercise, or managing physical symptoms, mental illness, drugs, vaccine hesitancy. It helps people to express in their own words their desire for change, which is what we call change talk. Okay, so we're examining their ambivalence about the change. We're planning for and beginning the process of change. It elicits and strengthens that change talk. It enhances their confidence in taking action and noticing that even small incremental changes are important, and it strengthens their commitment to that change. That's the huge part. We can talk about change, but having a commitment to the change is different. Okay. So this slide of the readiness rule is designed to help people express their own intention, commitment, readiness, and that willingness to change. So it might also help people talk about the small steps that they're already taking. So some examples would be a commitment might sound like, I will do X, Y, Z. An activation might sound like, I'm ready to do X, Y, Z. Taking steps. So I've tried to, or I am doing, and then it's evidence-based. So the research is showing that people who express the change talk are more likely to change. So we would use this ruler on a scale of 1 to 10. How do you feel about this? How hesitant are you? How ready are you? And we can use the questions in different ways, but the scale helps people to investigate how they really feel about it. And we're going to demonstrate this as well. Okay. So we're going to help our patients develop discrepancy because change isn't going to happen without it. So we're going to help the client see that some behaviors that they have don't mesh with the ultimate goals that are important or valuable to them. So we're going to help the client see the difference between their core values and their behaviors and help them to define their most important goals. We're going to create a gap between where the client is and where she wants to be. And we're going to allow the client to realize that their current behavior isn't leading to their ultimate goal and to be more open to change. So let's talk about ORS. And this is an acronym for open-ended questions, affirmative statements, reflective listening, and summary statements. This is the cornerstone of motivational interviewing. And really important, we're going to go through each one of these ORS in the following slides. So we're going to get in depth into them, learn about them, and then we're going to do some work around them and some polling. So you pay close attention because you're going to need it. Okay. So open-ended questions of the ORS, the O. This is going to require more than a yes or no answer. And Steve and I are going to demonstrate this. Because we're going to be able to create this space so people can share their stories with us. And generally, we want them to do most of the talking. I do want to say this, though. In a medical setting, when you're providing education, sometimes the provider may be speaking more than the client because it depends on the environment. If we're in a counseling situation, then we may be doing a lot more listening than we are talking. In a medical setting where you have a short period of time and you have a bunch of medical education you need to give to a patient, you may do more talking. But when you're skillfully listening and employing your spirit of MI, then it's going to come across properly. What we need to understand is that too many yes or no questions might feel like an interrogation to people, and it could hamper their sense of safety. And we don't want to impede a client's choice to honestly discuss their need to change with us. All right, so we're going to demonstrate a closed-end question. Okay, so closed-end question is, Stephen?
Do you want to get the vaccine today?
No. Okay, pretty cut and dry, right? That's the closed-end question. But now if we ask, we're not getting any information from that patient at all. But if Stephen, as the provider, asks me an open-ended question, look what happens.
I see you're not vaccinated. I'm curious about how you feel about it.
Well, I just don't think it's safe. And I'm hearing too many scary stories about it. Okay, so you can see how the open-ended question that he gave to me said, I care about what you think, I care about how you feel, and I want to get more information from you. Because once Stephen gets more information from me as the patient, now he's going to know what to address and what the pain points are, so to speak, that he needs to help me with. So let's talk about the A in ORS, which is the affirmations and the rationale for that. So with affirmations, we want to avoid sounding insincere. We're using affirmations sparingly, and we're doing that by helping them to identify their own motivation. We're going to focus on making a statement instead of praising, and we want to avoid cheerleading, and we're going to give an example of that. So we're using this to recognize people's strengths and successes and their efforts to change. That's really the most important part of an affirmation, recognizing their strengths, success, and their efforts to change. And it's going to help to increase their confidence in their ability to change. Okay, so let's give a demonstration of that. Gosh, Doc, it's a long haul to get in here today. No one in my family was supportive of me to get this vaccine. But I've got questions that I'd like answered because I want to decide for myself.
Well, you're a woman with a mind of her own, and you're looking for answers.
Yeah, I am. Thank you, Stephen. So you can see that what Stephen did here was he held up my autonomy, because I just told him, I just went against my family to come here. I just snuck out so I could ask my own questions. And so he sees that as an opportunity to help me get off the fence of indifference. And in doing so, he's holding up my autonomy. You are a woman with a mind of her own, and you're looking for answers. That feels good to hear something like that. That makes me feel stronger and ready to make my own decision in my own way, right? So he's moving me towards change by saying something like that. Okay, so now reflective listening, what does that do? That helps us to intently listen to our patients. And what it does is expressing the understanding that we have of their situation back to them. And the results are that we're building empathy between yourself and the patient. The people are feeling heard. And then we're encouraging their own statements about change. And a little bit of an example of that in the last slide. But what if you get a reflective listening wrong? You know, you're saying something back to your patient, you get it wrong. If your understanding is incorrect, the client is going to tell you most often. And this opens up more dialogue. And they'll tell you if they're sensing your spirit of MI. They sense your spirit of MI, they're going to be more open to correcting or elaborating, which is what you want them to do so you know what you can address. Okay, so let's start another brief role play to demonstrate what reflective listening looks like. So my husband's been pretty serious about not getting this vaccine. He's always gone on about it and the government and stuff, and so we just haven't been vaccinated.
It sounds like you're not ready to get vaccinated.
No, actually, I'm pretty sure I'd like to be vaccinated, but my biggest fear is that my husband won't support me because he's dead set against it.
Oh, I see. So you're wanting the vaccine. You just don't want to upset your husband if you do it.
Yes, exactly. Okay. So here you can see where he was corrected. Okay, he was corrected, and then he says, "Oh, okay. So you're not wanting to get the vaccine." I felt safe enough with him to tell him what my real reason was and to let him know, yeah, okay, now you've got that right. So let's continue on with this. So my husband's been pretty serious about not getting this vaccine. He's always going on about it and stuff. and the vaccine, the government, big pharma. I mean, I just haven't been vaccinated yet.
I see. Your husband has strong feelings about not taking the vaccine, but I'm hearing that maybe you're not so sure it's a bad thing.
Yeah, that's right. And I have some questions I'm hoping you can answer for me. Okay, so you can see here in the first one, I was able to correct him. And then here he gets it right the first time, which is great. He's recognizing how I feel about it. My husband has strong feelings, and that's what's holding me back. I don't want to have any disunity in my home. And so he's just really leaning into that, but he's also touching on this piece. You're not so sure it's a bad thing. He's focusing it back on me and my autonomy to make my own choices for myself. And so that opens me up to say, yeah, and actually I have some questions about it. So now I'm feeling safe to ask the provider those questions I've been afraid to ask to anybody else, because maybe I don't have a supportive environment at home. Okay. So what about summaries? Summaries, what are those? Okay. Summaries actually require careful listening to what the person said. And it's a great way to end a session or to assist that talkative person on the next topic. And a summary is just basically sharing back to them what you heard and what that looks like, how you understand what they said to you is. Okay, so we're going to have an opportunity to demonstrate that, and Stephen's going to help me demonstrate that in a few slides from now. Okay, so what's the rule? A rule is another acronym, is to remember, is that we're going to resist telling them what to do. We want to understand their motivations. Okay? You can understand their motivations. The other slide, he was trying to understand her. Her motivation was she really wants to know more. She might want to get vaccinated, but she's scared of what her husband might say. And then we want to listen with empathy, which he demonstrated that in the other slides, and empower them. So he was focusing on my autonomy in those, helping to empower me to make my own choices. Okay, so let's practice these skills. Now, remember, these are brief interventions, so don't worry if you don't get it perfectly. This is just an introduction. Okay, and you have opportunity to learn more about MI and many other possibilities, but let's give this a go. So we're going to do a poll. Now I'm going to read this, I'm going to read the scenario, and then you're going to pick the best answer in the poll that's going to come up on your screen that our host Mike is going to share with you. So here's the challenge. So we're going to have 4 of the ones that are going to come up, and then we're going to have a series of answers to choose from, and then we'll go on to the summary. So the first one for O is the open-ended questions. And here's the scenario. I was so afraid when I got the news about my cousin being in the hospital from COVID that I made an appointment to talk to you about the vaccine. I haven't gotten it yet. I've been too afraid. So which ones are the best? Which is the best answer that would represent an open-ended question? Number 1, I hear you. That sounds like it hit close to home. Number 2, I bet you're ready to get vaccinated now, aren't you? 3, tell me more about your vaccine fears. Or 4, how long was your cousin in the hospital? And go ahead and pick the best answer for that. Which one is the best open-ended question? And are those results showing on the screen, Mike?
Yep, they're on my screen here. It looks like so far 81% says, tell me more about your vaccine fears.
Excellent. Okay. And thank you, Mike, for that. And I might need you to give me the feedback on them because they're not up on my screen right now in my presenter mode. So thank you. So that's great. And yes, that's the best answer in this scenario. Tell me more about your vaccine fears, because that's open. It allows the provider to get more information. Now, there's other questions in here. How long was your cousin in the hospital for? That is an open-ended question, but clearly doesn't, thank you. I can see that now. It clearly doesn't apply to the situation in terms of what the provider really needs to get at. Okay, so thank you for that. So let's go on to the next one. So the next one is, I don't think it moved. Okay. The affirmation challenge. Okay, so you here you can see what distinguishes an affirmation from an otherwise good complex reflection. Okay, so here's the situation. My cousin was young and healthy like me. She didn't even meet any of the risk factors that I'd heard about. I figured if I got infected, it'd just be like a bad cold or something, but she was intubated. Kind of freaked me out. That's why I'm here to talk to you about it. So now, which one is the best affirmation? The one that holds up the patient's good qualities and their autonomy. Number one, sounds like you're not ready to take the vaccine. Number two, after seeing that, you're ready to learn more, maybe get vaccinated yourself. 3, there's evidence young and healthy people can die from COVID. 4, after seeing that, you were wise enough to learn more and maybe get vaccinated yourself. Okay, so if we could display those choices.
So far, we have about 40–50% participated so far. Keep it open for another few seconds yet. People are still participating.
Okay.
About 65% participated so far.
And I'll let you close that out, Mike, when you think it's good.
And I'll go ahead and end the poll.
Okay, thank you.
And share the results.
Perfect. So here in this one, there's a couple of good answers, but there's one that's better. All right, and in the last one, 54% of you chose after seeing that you're wise enough to learn more, and that is the best answer. So for those of you who got that one, that's great. And let me tell you the difference. Now this was a little bit tricky because number 2 and number 4 are both good answers, but number 4 is more of an affirmation. And what makes it different is that in this, the provider says, after seeing that, you were wise enough to learn more. Okay, so he's holding up her intelligence, her desire to take care of herself by using some of that language. So he's picking out the quality in her that wants to take care of herself. So you were wise enough to learn more. And number 2, he just says, after seeing that, you're ready to learn more, maybe get vaccinated yourself. Okay, but he's not holding up anything for her when he does that. It's not a bad response, but 4 is even better. So you can see that how that's distinguished from an affirmation from other, otherwise good complex reflection, which I'd mentioned. So that while accurate and demonstrating the empathy, it still doesn't explicitly affirm anything about the client's strengths, like being wise, determined, courageous, or being able to look ahead. Okay, so let's go on to the next one here. Okay, so this is the reflection. So I'm going to read this and then we'll do one more. This is identifying what the reflection is. Now, who knew my young, healthy 26-year-old cousin would be intubated in the hospital? We weren't that worried before she got sick. I mean, our uncle had COVID and it was nothing more than a bad cold for him. Your choices are, which one best reflects the reflection? Your uncle had an infection from COVID that was pretty mild. 2, you aren't someone who gets sick very often. 3, tell me more about why you weren't vaccinated long ago. 4, after your cousin went to the hospital, it made you realize this was potentially a bigger risk than you imagined. Okay, so please make the choice that is that best shows what a reflection is in response to this patient statement.
So far, we have about 60% of the folks participating in it.
Great.
We'll leave it open for maybe about 10 more seconds. And we're going to close it up.
Perfect. If you could display those. Thank you, Mike. Okay, so we have kind of a spread here. Most of you answered for after your cousin went to the hospital. It made you realize that this was a potentially bigger risk than you imagined. And that was great. And the number 4 is the best answer because it was stating what the reflections are looking for or what they're getting at. It got at the heart of what the patient was bringing. Okay. And it touched on this. It made you realize it was potentially bigger risk than you imagined. So that's a reflection that helps to identify what this patient was concerned about, but it's also focusing, it's focusing on her concern. So we're putting that on the table because, like I said, we're helping people to get over the ambivalence. And this is going to help her to have that information foremost in her mind by focusing on that piece of pulling it out of the conversation and putting it back to her in that reflection. So now let's do one more. Now, Stephen's going to assist me with this summary challenge. Okay. We often would pull somebody from the audience, but our platform doesn't support that right now. So Stephen's going to help us with this. But I want you to think about, as I read this, what your summary would look like. If you have to repeat back to the patient what you was said and what you heard, but not necessarily parroting back every single piece of it. The point of a summary is not to remember every single piece of information that the patient gave you. The point is to be able to recall the heart of what they said, the heart of their concern or of the points that they made, so they feel heard by you. So it doesn't have to be perfect, but it needs to be compassionate and empathetic. Okay, so let's take a look at this, and Stephen's going to help me with it. So the summary challenge, here it is. Oh gosh, it had me totally freaked out to see my young, healthy cousin intubated in the hospital from COVID. We never thought any of us would get that sick. I mean, seriously, my uncle was fine after getting it. We felt bad for the old and unhealthy people that were dying, but gosh, I figured we were pretty safe since our risk factors were so low. I mean, I wasn't against the vaccine. I just heard conflicting stories, and I figured it was safer to develop that natural immunity they talk about than take this controversial vaccine. Ugh, but now I'm realizing I'm not so safe after all, and that's actually why I'm here. Stephen?
Yeah. So what I understand is that it's a really scary situation to see your family members get sick with COVID and some of the things that can happen from that. And I'm really happy to hear that you may be more interested in learning about or getting the vaccine.
Great. Thank you, Stephen. That's great. And so what I want you to hear in that is that it's not in depth. He didn't go over every single detail I said. And if you do, that's fine too. But what he got at was that I was fearful. I had a problem, in my family that brought me to him today. And he was able to reflect that back to me, and that I, want to talk about the vaccine. And so he got to the heart of what I wanted to say in the summary. And so that was great. So let's move into a more in-depth role play so you can really see this in action. So what I want to bring to you today is we're going to be doing a full role play. And we'll be playing fictional characters, but the fictional characters, the patient role is biographical for me, but the scenario is biographical for me based on my life experience and background, and my work in tribal and rural communities and my own biographical background. However, the story and the interaction between the provider is fictional and also based on experience. So we want to bring that authenticity to the role play. So we're going to show you the 4 different MI approaches that you can use, as well as some bonus skills in these. Now, let me explain the setting. The setting is a clinic. It's located on tribal land at the end of the Alaska Peninsula, bordering on the Aleutian Islands, which is, I don't know if you can see where it says Aluktik and Supiaq area there. It is the only medical facility in town, and it's tribally run and IHS funded. It is also an FQHC, federally qualified health center, and serves the entire community of seasonal cannery workers, residents and non-tribal residents. This is an isolated fishing community of less than 600 full-time residents, 900 annual. The small town is accessible only by taking 2 small airplanes or by sea. It is 750 air miles from a major city, and travel out, even for emergencies, is unreliable due to frequent bad and inclement weather. Now, the provider is we're going to be calling him Dr. Fowler, which is Stephen's role. He wants to serve his new community, but knows that many locals are vaccine hesitant or resistant. He's relatively unfamiliar with the local culture and will demonstrate, using the spirit of MI, how he easily and respectfully engages with this new patient so he can build and maintain relationship and set himself up for success as a provider in his new clinic. Now, the patient be using the name Lena. Lena is a 38-year-old female who is an Alaskan-born and non-tribal descendant of Standing Rock Sioux and European ancestry, who is married to an Alutiiq, Alaska Native man. She is mother to 3 Unangan and Alutiiq children, who are all members of the local Agdagu tribe. Her husband is a commercial fisherman, and she is a stay-at-home mother. Like other residents, they live a subsistence lifestyle and take pride in the land and sea, and are protective of their community and often cautious of outsiders. Okay. So we're going to start our role play here, and we're going to show you what approaching resistance looks like. We're going to discuss this as we go. Okay, now please pay attention to the sound and stop sounds of the role play so you know when we're beginning and when we're ending. And this is how Stephen is going to approach my resistance.
Hello, Lena. Thank you for waiting on me. We've had a shipment of the COVID vaccines and some medical supplies come in, so I was getting in my daily workout with helping unload the truck today. There was a lot of stuff.
Oh gosh, I bet. Yeah, I saw that plane come in. But yeah. Hey, you're the new provider in town. I heard there's an uptick in cases again. I guess you're gonna try to convince me to get vaccinated, huh? Well, good luck. That's all I'm saying.
Yeah, I'm really excited to be here. I came from Montana before taking this position, but I'm originally from Michigan. Are you from here?
Yeah, actually, I was born in Alaska, but I married into this community. But I've been here for a big part of my life anyway. Okay, I just gotta say, Doc, no offense, but I should warn you, providers don't last long around here.
You've seen a lot of medical providers come and go. Maybe you're wondering how long I'll stick around. Well, I'm loving it so far.
Yeah, well, I'm glad you like it, but people don't stay long. I mean, it's normal. We're used to it.
Well, my contract says I'll be here for at least 2 years. That'll give me lots of time to get to know all the new patients and hopefully learn how to put up some fish this winter too. I was wondering, what's the best kind of salmon to use for making this kippered fish I keep hearing about?
Excellent. Thank you, Stephen. So here you can see that Stephen is establishing rapport with me. In approaching my resistance, he's identified I'm resistant because I already kind of put that out there. I've let him know, hey, people like you don't stick around. So I'm kind of putting up a wall already in this. And what Stephen's not doing is arguing or taking offense. What he is doing is he's not talking about the vaccine yet. He didn't take the bait, so to speak, when I said, oh, you're going to get me vaccinated, huh? He just didn't even address it. He went straight to establishing rapport with me. And then he kind of brought himself into the local environment. Hey, you know, what do you think about this? started talking about fish because that's something that is definitely important to me as a patient and my lifestyle. It's the crux of our community. And so he's finding something that he can connect with while not being arrogant in any way. He's asking my thoughts and opinions and trying to connect with me. So take note of that. Now let's go on to the next slide. So in this next one, he is going to approach my resistance and he's going to ask me to share my concerns about this vaccine, and pay close attention to how he does this. Well, my husband says the silvers are actually best for smoking and canning, but I love the king salmon for eating as it has the most fats in it. I'm convinced that the fats help with my skin condition, which is why I'm here. And I was hoping you could look at this eczema today and see if there's anything you can do about it, any creams or something like that I can use. It's really itchy.
Well, I'll take that under good advisement. Yeah, we can look at your skin today and see what can be done about it. You mentioned when you came in that I might also be able to ask you about getting vaccinated. I can see from your chart that you haven't had one yet. Would it be all right if I talked with you about it, maybe just a couple of minutes so I can understand what your concerns are?
Yeah, I guess. I just don't know that it's really safe. I don't trust that it came out so fast, or if it even works. I mean, I've heard a lot of bad things about it, and seriously, I just don't know who to trust.
Yeah, I understand that, but I can see that you're a woman who wants to keep herself and her family healthy. So you're just not sure about the vaccine. Lena, I get that, and I'm here to support you and help provide the best information that I can about the vaccine.
Thank you. Okay, so he opened up the question. He, addressed my needs, but he said he took that in that she gave him. You're going to ask me about it, aren't you? And so he went back to that. Now that he's established some rapport, he went ahead and went forward. But what he did was he asked my permission. Okay, that's my permission. And he asked me what my concerns are. What do you think about it? Rather than just going into lecturing me about why I need to have the vaccine, he said, what do you think about it? And that's really important for someone to feel heard, valued, and part of the conversation. Okay, so that was great. And let's move on to the next one. And so he's going to find out how confident I am. And this is going to help him as a provider to know where I'm at on the fence and how far I need to go to get to a point of accepting the vaccine. Now, this again works with all kinds of healthcare issues. You're talking with diabetic patients or heart disease or obesity or anything like that. Same skills apply. Okay, we're just applying these to vaccine hesitancy. So let's go ahead and whoop. No. Okay, so let's try this again. I pushed the wrong button. So we're going to do this role play now.
I've been asking some of my patients this question, and I'm curious what your take on it is, since you have safety concerns. If I may ask, on a scale of 1 to 10, 1 being not confident at all and 10 being totally confident, what number would you choose to represent how confident you are in the vaccine?
Confident? Gosh, well, I guess I'd be about 4.
Why are you a 4 and not a 0?
4, not a 0? Well, I don't know. I guess I got my kids their vaccines when they were growing up, and I guess they were fine. I got mine when I was a kid, and I'm fine. I just don't have a lot of confidence in medical care these days. Everything is so confusing.
So on one hand, you are entirely trusting of the medical system, but on the other hand, you support vaccines in general, evidenced by the choices you made in the past to protect your kids from diseases, and you say that you've benefited from them as well. Do you have any other reasons?
Well, yeah, and now that you ask, I mean, it seems like this is so political. Half my family's for it and half my family's against it. I mean, I'll share with you, my husband's grandfather, he buried half of his own village during the 1918 flu epidemic at 17 years old because they didn't have a vaccine. I mean, I can't even imagine. And the diphtheria vaccines, those were brought in by sled dogs up north. And that's what started the tradition of the Iditarod. That's that sled dog race, But historically, Alaska Native and American Indians have also been mistreated and abandoned medically over and over again. So there's a lot of mistrust with my community. It's why the tribes in Alaska have fought so hard to have control over their healthcare services. But even with that oversight, people like you, I mean, no offense, but you come here, we come here to pay off your student loans and you tell us what to do and how to live, and then you just leave. So, I mean, my sister-in-law, she died from medical negligence in her village. So yeah, my family doesn't have a lot of trust in what the federal government or medical says we should do. I mean, I don't know. I just don't know what's the best thing to do.
Wow. I understand. I can see why this feels like a polarizing issue. I'm sorry about your family member. I'd be skeptical too. So with all those relevant viewpoints, I'm curious, what would it take for someone in your shoes to get from a 4 to say a 9?
Well, I guess I'd need to see more evidence that it won't hurt me or my family. Yep. Okay. So great. Thank you, Stephen. So you can see this patient had a story to share. And, he didn't go into, having to recap everything I said, but he did meet me with empathy. And he said, wow, I can understand why you'd feel polarized about this. And that felt good to me as a patient, because I felt like he really heard the pain that I've had in my own family and historically, and why I would be concerned, and why I want to support my family and what they decide is right or wrong for them. And he's really able to meet me there with the language that he uses, but also move me towards the change, which is, I'm curious, after he met me with empathy, then he goes in to ask me, well, what would it take for someone in your shoes, meaning I understand, I hear the pain, to get from a 4 to a 9? Okay, so he very compassionately and gently moves me forward. Okay, so let's move into the next one. This is where he's going to ask permission to share information and reflect back to me in this. And he's going to demonstrate that continued empathy with careful summary and then asking permission to share his expertise. And I want you to hear how he uses his medical authority in a very respectful and accessible way. So we're going to begin.
So let me see if I understand correctly. You're a woman who cares deeply about the health of her family. You want to respect those around you, and you take into consideration both historical and present day information. A lot has happened in your family, and you've heard a lot of confusing information. You're also wondering if taking the vaccine is actually a good way to keep yourself and your family safe, but you need to feel clear about how safe it is. I have heard a lot of these stories myself. I had my own initial concerns given all the wild information that's out there. However, as a trained medical provider, I am diligent about following vaccine safety and the science around it very closely. As a part of your appointment today, would it be okay if I go over with you some of the information that I know about the COVID-19 vaccine, like why it's safe, even though it's been rolled out so quickly?
Yeah, I'm not sure you're going to change my mind, but I would be open to hearing more about that.
Sure. You're skeptical and still not sure. That's no problem at all. I'm glad we get to have this chat.
Great. Okay, so if you can hear how he used his medical authority. I am a trained medical provider. I'm diligent about following vaccine hesitancy and safety. Would it be okay if I share with you? So he is establishing his authority in a respectful way. Now, remember, the research shows that people who are ambivalent will often go with their provider's recommendations. But first, we have to establish the relationship and the empathy so the patient feels valued, heard, and seen before they're going to follow us down the road of education we have to share with them. And Stephen's doing an excellent job of this in how he's connecting with this patient empathetically and authentically. Okay. All right. And in the next one, we're looking at how the use of education and stories to help influence people's perspective can be useful. You can see how avoiding arguing, but just focusing on the disease prevention is so vital. Okay, and he's going to do this by using personal vulnerability and continuing to use my name for connection, not arguing. And this is how that looks, because our patients, it's important to know, is that they have varying concerns that you might be able to address, but you may not know everything. So it's important to have your education points set up or be prepared with handouts. And I'm also going to talk at the end of this presentation about some ways you can expand upon that and some resources to share. But let's begin this role play now.
Many people have concerns and want answers, including me. I know it feels like the whole process was so fast, but since you're open to it, here's some background information. At the beginning of the COVID pandemic, our government passed an EUA, Emergency Use Authorization, which really sped up the whole vaccine process. It did not allow the pharmaceutical companies to cut any corners or shortcut the process, but it did cut out a lot of the bureaucracy or paperwork and the time it takes to do so. These first 2 vaccines use messenger RNA, which researchers have been studying for decades. Once the vaccine was developed, they were able to speed through the testing phases, which usually takes years. They started with a very small group of volunteers, then a larger group, and finally a very large group with thousands of volunteers. At the same time, they were already in production, creating thousands of doses while still in the testing phases. All of these were possible because of the large amount of funding that the federal government gave the pharmaceutical companies upfront to get this done as fast as possible. You see, this isn't our grandparents' vaccine. Our technology has vastly improved our ability to keep us safe and healthy at a more effective and rapid rate. This is actually one of the safest vaccine rollouts in history because the technology is helping us along. After hearing how the vaccine was rolled out so quickly and about why we can know it's safe, what are your thoughts?
Gosh, well, I didn't know why and how they were able to get it out so quickly and still have it be safe, because that was kind of scary. But yeah, thanks. That does help me understand more if I take this shot, but I'm still not sure. What about how effective it is? I mean, people are still getting COVID even with the vaccine. Why should I bother?
That's a great point. COVID-19 vaccines are effective at preventing severe illness, hospitalization, and death. However, since vaccines are not 100% effective at preventing infection, some people who are up to date on the recommended vaccines will still get COVID. The vaccine reduces your risk of infection. Once you receive your first shot, your body begins to produce antibodies to the coronavirus. These antibodies help your immune system fight the virus if you happen to be exposed, so it does reduce your chance of getting the disease.
Oh, okay. So how is it if I can get COVID, even if I'm vaccinated? And then what if I've had it once already? I mean, won't I have natural immunity then?
Great question. The COVID-19 vaccine causes a more predictable immune response than infection with the COVID-19 virus. The benefits of vaccination outweigh the known and potential risks. A study showed that for people who already had COVID-19, those who do not get vaccinated after their recovery are more than 2 times as likely to get COVID again compared to those who got fully vaccinated after their recovery. Getting vaccinated is also a safer way to build protection than getting sick with COVID. COVID vaccination helps protect you by creating an antibody response without you having to experience the sickness. What are your thoughts on that?
Without me having to experience it. Well, yeah, I guess that helps. I mean, it's definitely giving me more to think about.
It's been a long ride for everyone, and your concerns are understandable. If you don't mind me sharing, I have personally treated people who have gotten very sick from COVID. I'm sure you've heard all kinds of stories about people dying or suffering from COVID, but I'd like to share a more personal story with you. It's a little sad, but I think our stories are really important to talk about with such an important issue.
Yeah, sure, I'd like to hear it.
One of my favorite cousins is married with 2 children. Her husband, Greg, was diagnosed on Thursday with COVID, and the next day his symptoms got worse, and tragically, he died before she could even get him to the hospital. This was a huge shock to our whole family and has devastated my cousin and her children. I can only imagine what they've been going through. It's made a huge impact on my commitment to helping my patients stay safe and healthy wherever I can. Now, this is just my family story, but I'm curious, what are your thoughts when you hear stories like this?
Wow, well, I'm sure sorry about what happened to your family. That's horrible. But I mean, I can only imagine if that were to happen to one of us. sometimes we're seriously weathered in here for days. My father-in-law's first wife was a nurse here, and she took off in a plane with an injured patient doing a medevac in bad weather. The plane crashed and everybody died. That's another reason I'm sure about this for so long. Okay. All right, that's great. So this was a longer portion of the role play, but what I want you to hear is that he put his own story out. Now, you don't have to put your own, most terrible story that you have about your life with your patients, but you can pick and choose, right? You can have a brief story or something that's vulnerable that says, hey, this is really important to me. Or, I worked in a hospital and I saw a lot of people pass away from COVID, and it really, put my judge up, and now I'm going to help people more. I mean, just to whatever it is that you want to share, you can. It doesn't have to be the deepest, darkest secret of your life, but something that puts your heart on the table that says, hey, I'm here with you. We're in this together. We're in this together. That's the spirit of motivational interviewing, is we're in this together and I'm here to help. Okay. All right. So this is a bonus skill that I want to share with you. Okay, there's two that I'm going to share with you, and it's going to help your patient to explore their ambivalence. All right, so here's the first one, is you want to ask the patient, what might be bad about taking this vaccine? And you can use this for anything, like, what might be bad about, having to take your metformin every day, right? I mean, and then you might ask them the opposite question, which we'll get into. So this is really useful for all types of things. So we're going to demonstrate what this looks like. Okay.
What might be bad about taking this vaccine?
Well, what would be bad about it? Well, I might make my husband mad. I mean, he's dead set against it. So I'd have to deal with that. He might call me a traitor, and that won't feel good. And I'll have to listen to him go on about it. But I also might get sick from the side effects, and I can't afford to be down for even one day. I mean, I have too much on my plate. And if they find that it causes me some unpredictable harm down the road, it'll be too late.
Mm-hmm. So on the one hand, you're concerned about how your husband will say and how that affects you. You're also a very busy woman and can't afford any downtime, or you'll get behind on your duties. You're wondering what will happen down the road if something unexpected comes of this.
Yeah, that about sums it up. I mean, all that makes me very nervous.
Okay, fair enough. I'd like to ask you another question then.
Thank you. Okay, so here you can see that Stephen got out of me what I'm really afraid of. So now he knows what he wants to move me away from and move me towards what we talked about earlier as the change talk. That's sustained talk right here, which is, these are my reasons for not changing. Oops. But this is what we want to focus on now. What might be good about taking the vaccine? So the more change talk we hear from an ambivalent person, the more likely they are to move in the direction of change. Okay, here we go.
Tell me, Lena, what might be good about taking the COVID vaccine?
Well, one day down is bad, but if I were really sick, I'd have a lot of days down. And gosh, what if I had to go to the hospital like my cousin? Or maybe if I couldn't even get out of here because of bad weather. Even though my husband thinks natural immunity is best, I'm worried that I won't be one of the lucky ones. I mean, I have children to raise.
Do you have any other reasons?
Yeah, I guess maybe I'd probably feel safer. A little more secure that if I did get it, I'd be okay.
So you value feeling safe and staying healthy, so you can be there for your family. Being vaccinated would bring you a sense of security, especially living out here so far from the hospital. You've got kids, so this all makes sense.
Excellent. So here you can see how he moved me towards change talk. We want to start with why they don't want to do something and end with why they do want to do something, okay? Because that gives us the opportunity to focus on that part of it, all right? And then he also probed a little deeper and asked me for more reasons so I could have more change talk. Are there any other reasons? So now I have to dig a little bit deeper of why I want to get vaccinated. Okay, so this is a great skill. And then he summarized it, reaffirming to me back so I could hear what I had to say about why I want to get vaccinated. You value being safe. And so he's holding out the best in me and staying healthy. He wants to validate that I want to be there for my family. He's validating my need for security and, acknowledging my fears of being so far from the hospital, and then reaffirming also to me that I have children that I want to be around for. Okay, so he's done a great job in that summary of reflecting all of that back to me so I could hear my own change talk. Okay, so in this next fourth step, okay, out of the bonus skills into the fourth step, we're affirming the autonomy, and a strong vaccine recommendation often works. Now we've established trust, we've supported the patient's autonomy, seen the best in her, created a rapport, and now the provider is going to demonstrate vaccine recommendations and the affirmation of autonomy.
It's clear you definitely don't want to get this virus or any of your family members. You know, Lena, I'll be honest with you. I spent my medical career studying and advising patients on how to live their healthiest lives. I truly do believe in this vaccine, which is why I took it myself. I gave it to my own family members and strongly recommend it to all of my patients. I think you should get it today. Having said that, it's your decision. Only you can make it. What do you think you'll choose?
Well, you presented some good points and made me think about this a lot more. I can see why there are more benefits to taking the vaccine than not taking it, and then getting the COVID and really being out of commission or worse.
It sounds like you might be ready to get vaccinated today. Do I have that right?
Yeah, I think I'm going to go ahead and do it.
I appreciate that you really take the time to be careful about your decisions with your health. I wish all my patients were so diligent. I think you're making the right decision. What do you think you'll choose for your children?
Well, after our talk today, I've decided I'm going to take my kids and get them vaccinated too. I mean, I can deal with my husband later. Maybe he'll come around someday.
Well, let's see what we can do about that eczema you've got going on. And then when we're done, I'll have the nurse come in and get you vaccinated before you leave. How's that sound?
Sure, sounds good to me. Thanks for taking the time with me today about it, Dr. Fowler. I think you're going to do well here. Excellent. So you can see how in this space, he made a strong vaccine recommendation because he was now safe to do so. He's heard me and I'm hearing him. We're on a level playing field, and I'm respecting his medical authority because he's created a space where I can and want to respect his medical authority. Okay. And he really put that out there very clearly. And that was so helpful to me as a patient. And that helped me sway at the very end to go ahead and accept the vaccine. And then he threw in a bonus question. What are you going to do about your kids? So now he's reaching more into the community. Now, for all of you out in on reservations and working in different tribal communities, people are very close, and it is 2 degrees of separation. And so your reputation and the way you work with one patient, it could have a big trickle down effect for the community that you're living in. I'm sure many of you right now are thinking, yeah, that's for sure. And so this respectful way of communicating and trust and getting people to trust you is good medical practice. And it's going to help you to reach more people for vaccine hesitancy, for all different types of diseases that people are facing. But what happens now if the patient continues to decline the vaccine or doesn't want to make any changes? How does the provider handle that and still maintain relationship? So let's have this example.
So Lena, what do you think you'll choose today?
Well, I'm still not fully impressed with this vaccine. It's not for me. I don't want it, not at all. I'm not taking it.
I understand. This isn't something you're willing to do right now, and it's your decision to make. May I share one more thought with you before we move on?
Yeah, go ahead. It's not going to make any difference, but yeah.
Thank you. Listen, if I were in your shoes, I would be hesitant too, looking for answers just like you are. Lena, as a new medical provider here, it's my sworn duty to do no harm. I firmly believe that the COVID vaccines are effective at helping protect against severe disease and death, including the known variants currently circulating around. I believe the benefits of vaccination outweigh the known and potential risks, which are rare. That being said, what I've learned about you today is that the health and safety of you and your family is really important to you, and wouldn't be so diligent in asking the right questions, or you wouldn't be so diligent in asking the right questions.
Yeah, that's true. It is very important to me, but I just don't trust the vaccine. I mean, I'm sorry, I'm just not doing it, Doc.
I hear you. Today isn't the day. I'm sure we'll offer it again, or you can come back anytime if you ever change your mind. Would you accept an informational handout on COVID to take home?
Yeah, you can give me whatever you want, but just don't expect miracles.
I'm really glad to get to know you a bit today. Thanks for sharing your story with me. Now let's take care of that itchy rash you've got. That looks uncomfortable.
Excellent, thank you. So you can see that he still had enough relationship with me to give me a little more information. Okay, he still had enough relationship with me to be able to say, hey, this is why I really believe it, because what he's doing is that art of persuasion. He may not have convinced me today to take it, but I may change my mind a month from now or a few days from now because of the conversation that we've had today, because I felt heard, respected, and maybe I just need a little bit more time to think about it. But now I feel a little bit more autonomous and strong in my ability to make my own decisions about my own health care. So in all of this, you're letting the patient know that you're going to offer it again with a strong recommendation. You're being honest about what you know and what you don't know. You're going to reflect the heart and the intention that the patient had, and avoiding argumentation. So argumenting. So he was able to say, hey, you're somebody that really cares about your healthcare. So he's reflecting that back to me again. And these are the parts that's going to stick with me. Yeah, I care about my healthcare. I want to stay safe. And so that'll stick with me later. He's still offering reading material, and then just in the end to relax and know you've done the best with your patient. Now, what I also want you to hear is that if you've got a hardliner that is going on or angry or hostile towards you, you're not going to be able to have these conversations with them. So your point with those people is to maintain relationship, okay? So that and to build trust around with them, because maybe they're not listening to you today, but maybe after a couple of visits and they see that you're somebody that's worth listening to, they may come around in the future. So don't be scared or too offended by the hardliners, because they're humans too. And they also can learn and possibly change their minds. Or even if you don't get them there, you may get them to make changes around other areas in their health. Maybe they have diabetes, maybe they have heart disease, okay? And they're not taking care of that. And maybe you can help them there. So just know there's a bigger picture to this whole thing when you're the medical provider. Okay, so some of the last tips is if you want to ask somebody's advice, that's a good idea. It's actually a good practice. This is really helpful sometimes with the hardliners, because this also helps to bring them in. Now, you may know that your patient's still hesitant and resistant, and accept that. But you can consider one more move to create that environment of trust. This is by asking for their advice. And we're going to do another brief role play to demonstrate that.
I know you're choosing not to get the vaccine today, but could I ask your advice on something?
Yeah, go ahead.
Other people feel strongly about not getting the vaccine, so you're not alone. As a medical provider who believes in the vaccine and that it could save my patient's life someday, how do you think I could better deal with this for my patients who feel like you do? I'm new here and I want to help out, but I want to be respectful too.
Yeah, well, I appreciate you hearing me out. And honestly, I like that you're not being too pushy. I guess you could help your other patients by hearing them as well, whatever they've got to say about it. Some people, maybe they'll change their minds. It's just not me, not today anyway.
Thanks for the feedback, Lena. That helps a lot.
All right, thank you. So you can see that he's still in this, showed that, I believe in the vaccine. He still has a strong vaccine recommendation. but he's turning it over to her. How can I level the playing field even more and bring you in? And maybe the patient has some good advice for him that's going to help him in this new community he's in, so he can possibly reach someone else about the vaccine. Okay, now you're not going to have this conversation with every patient that comes in. You're not going to have the whole scenario, but what I hope you take away from this is pieces and parts of it, and the feeling that is demonstrated in how to connect with patients to get them to move off the fence of indifference. And so there's questions that people have about the vaccine often, and the CDC website says some of the most common are like how the first COVID vaccines are different from others. What about allergic reactions, if they should be worried, and the fast development of them. And has the vaccine been tested long enough to know if there's long-term side effects? That's a concern people have. Another one is there a microchip in the vaccine? That's been a common question as well. And those are authentic questions that we need to be able to address. But how do we do that if we don't know everything about it? So teamwork ideas is something I'd like you to take back to your clinics as a consideration. And then this is the importance of leadership, because the leadership has to set this educational environment around COVID-19 or any other disease or public health issue we have to face. They have to give the staff time to deal with it. Displaying education in the handouts in the lobby, walls, on TV, videos, posters, things like that. That's that passive education that people can get in the community, at community centers and the grocery stores. Creating a continuity of messaging amongst the staff, so everyone is providing a similar message. So there's that unity of the medical staff. And then, like I said, setting aside time for staff meetings. So the people can get together, tasking a team or a person with presenting educational resources and information. So you might say, hey, Joey, you're going to research this aspect of COVID-19. Here's the resources. Check it out and then come back and present at our next staff meeting about it. So everyone's kind of getting that shared similar message, and they're giving their resource. They may create handouts from whatever they research. There's different things that you can get from the CDC websites. You can make your own handouts and leaflets that are applicable and speak to the community that you are in. And then you can practice your MI skills together. So you can role play for success. If you learn more about MI, you can sit down and have this community of learning with one another and just have a mock conversation and see how you do. Right? Don't be too hard on each other, but be realistic. It can help you to learn how to identify and work on those ways of upholding our patients and connecting empathically. So here's some resources that you can use, articles and videos to study. And so this here is in the slide that you can check into. These are not exhaustive. Again, I'm not expert in COVID-19, just in motivational interviewing. And so these are at your disposal to check into and decide for yourselves. But at the end of this, you don't have to run off just yet. If we're going to see if we have any questions from the audience that we might be able to address. So I'm going to stop sharing my screen right now and check back with our hosts and see if we have anybody that had questions.
Doesn't look like we have any questions at the moment, but we do have some folks interested in getting the slides afterwards. So we will make sure to get those out to all of those who registered, and we will also have them on our website.
Okay, looks like we do have a question, so if we can give a minute for that to come up. You probably have to type that in the chat because this is not set up for audio.
Right.
So what I recommend for patients who are combative or feel strongly against the vaccine, it's really important to not argue with people that are very combative or argumentative. And it might just be to say, I hear you. And so in the beginning of our demonstration, Stephen didn't address my vaccine hesitancy. right away. They may be wanting to engage you in a combative way and have the argument. And so you want to avoid the argument and focus on the relationship with the patient. And so it may just be if it's very clear that they are quite angry, quite combative, and they really want to have a conflict with you, to focus on the relationship, don't argue, say, I hear you. And then you may switch the conversation to why they're actually there to see you today. Now, maybe they're there to actually maybe they want to get vaccinated, but they're scared of it. And so they come to it in a combative way. And this is where the MI skills can help you. Well, tell me more about, your fears about it. And then you might just jump into the what would be bad about it, what would be good about it kind of thing. So you just kind of go into that piece. Well, what would be bad about the vaccine? Well, they're going to have 50,000 reasons why. Well, what would be good about it? Well, maybe they haven't thought about that. And then, you can just open it up to say, hey, I'm here to help and serve and, you and the community. And if this is something you feel you want to do, we're here for you. And if it's not, that's okay too. It's my job to, help you with your healthcare needs. And so you really just kind of avoid it. If they're angry, these skills are for people that are on the fence. But for those hardliners, we will just hear them, and then you can also kind of start to change the subject. So if they're going on about it, obviously they're not going to get vaccinated today. They just want to vent. You can give them a couple of moments to vent, and then get back to why they're there. I really hear you've got some concerns, and you feel pretty strongly about this vaccine. You're somebody that cares about your health, and this isn't something that you're willing to do. But I am wondering what you did want to address today, because I see in your chart that you've had a lot of knee problems and you've got some arthritis and that you've been pre-diabetic. And so you just kind of switch back to whatever it is they are there to, or what they should be being seen for, and just allow it to lie. Focus on the relationship with the patient. That's going to be your biggest key. And then changing the subject back to other parts of their healthcare and validating that they've been heard, and hold up that good piece of them. You're somebody who feels pretty strongly about this. And, I respect that. I respect that you feel strongly about your healthcare. And, I'm just wondering, how do you think that applies to the arthritis that you're dealing with? How's that going for you? Have you been in a lot of pain lately? And just bring it back around to that. There's some people that are going to be belligerent, and they are the outliers. They exist, they're the outliers, but if they do, you just have to do what you have to do in the situation. That's all there is to it. And if somebody's unsafe, then you take that to the next level. Hopefully you're not facing that, but a patient in any situation, in any clinic, can come in an unsafe, belligerent manner over any issue. And so we always have to be prepared to deal with that as healthcare providers, and always have a safety plan.
All right, Sevilla, we are out of time. It looks like we do have some really great questions that are still coming through the chat box. I'm hoping that we can, the two of us, connect and maybe try to answer some of those to send out in a follow-up email.
Sure.
But we are out of time, and I just want to be respectful of all of those who are registered today. We can go ahead and answer one more question, or we can try to do that in the follow-up.
I'll leave that, it's up to you.
Well, let's be respectful of everybody's time here. I know it's the end of day for East Coasters, and just the middle of the day for those in other time zones, but we really appreciate everyone joining today, and especially Sevilla and Stephen. Appreciate you delivering this training and all that it has to offer for those in tribal healthcare settings. So thank you.
Thank you. Thanks for being here, everyone. You guys have been fantastic.